During pregnancy, most mothers often wonder about the health of their baby. It's common to question whether the baby is developing well and if everything is going as expected. While every pregnancy is unique, understanding the signs that show a healthy baby in the womb can provide comfort. Being aware of any warning signs that something may not be right can also help you know when to seek medical advice. In this video, we will discuss signs of both a healthy and an unhealthy baby in the womb, helping you feel more confident and better prepared as you navigate this important journey. Pregnancy is a time filled with excitement, but it also comes with concerns, especially when it comes to the baby's well-being. Let's begin by talking about the reassuring signs that point toward your baby's health. One of the key signs that your baby is developing well is regular movement. This movement is often referred to as quickening. Most mothers begin to feel their baby move between 18 and 25 weeks of pregnancy. At first, these movements may feel like flutters or small bubbles in your belly. Some women describe it as a tickling feeling. As the pregnancy progresses and the baby grows larger and stronger, the movements will become more noticeable and frequent. By the time you reach the third trimester, you will likely feel the baby moving regularly throughout the day. These movements can range from light kicks to stronger jabs and rolls. Each baby has their own pattern of activity. Some babies are more active during the day, while others seem to be more active at night. Paying attention to your baby's pattern of movement is helpful because it allows you to recognize what is normal for your baby. If you suddenly notice that your baby is moving less than usual, or if you don't feel any movement for several hours, it is a good idea to contact your healthcare provider. While it may not always mean something is wrong, reduced movement can sometimes indicate that the baby is not getting enough oxygen or nutrients. It's better to be cautious and get checked if something feels off. Another important sign of a healthy baby is steady growth. Your doctor or midwife will monitor your baby's growth during your prenatal appointments. One way they do this is by measuring your belly, also called fundal height, which can give an idea of how your baby is growing. Ultrasounds are another tool used to measure the baby's size, the length of the bones, and other important aspects of development. If your baby is growing well, it means they are likely receiving enough nutrients and oxygen from the placenta, which is key for healthy development. However, if the baby is not growing at the expected rate, it may be a sign of a condition called intrauterine growth restriction, IUGR. IUGR can happen if the placenta isn't working properly or if the baby is not getting the nutrients they need. In cases like this, doctors may perform additional tests to monitor the baby more closely and, in some cases, recommend early delivery if it is deemed safer for the baby. A healthy baby will also have a strong and consistent heartbeat. Your doctor will regularly listen to your baby's heart during prenatal visits. This is often done using a handheld device called a Doppler. A normal fetal heart rate typically ranges between 110 and 160 beats per minute. As long as the heartbeat is within this range and sounds steady, it's usually a good sign. If the heart rate is too fast or too slow, it might indicate a problem. In some cases, the doctor may want to do additional tests, such as a non-stress test or a biophysical profile, to make sure the baby is getting enough oxygen and is not in distress. These tests are painless and involve monitoring the baby's movements and heart rate over a period of time to make sure everything is functioning well. Amniotic fluid is another important indicator of your baby's health. This fluid surrounds your baby in the womb and plays a vital role in protecting the baby, allowing for movement, and supporting the development of the lungs. The level of amniotic fluid is checked during ultrasounds. If the fluid level is too low, called oligohydramnios, or too high, called polyhydramnios, it can sometimes indicate a problem with the baby or the placenta. Low levels of amniotic fluid can restrict the baby's movement and cause complications, while too much fluid can sometimes be a sign of birth defects or other conditions. Doctors will monitor the amniotic fluid levels closely to ensure they stay within a normal range. If there are concerns, they may suggest certain treatments or additional monitoring to keep a close eye on the baby's health. Your baby's position in the womb also offers insight into their well-being. Throughout pregnancy, your baby will move and change positions many times. By the third trimester, the baby should ideally settle into a head-down position, which is optimal for birth. If your baby remains in a breech, feet or bottom first, or transverse, sideways position late in pregnancy, it could pose challenges during delivery. In some cases, your doctor may recommend trying certain exercises or procedures to encourage the baby to move into the correct position. If the baby does not turn, your doctor will discuss the safest options for delivery, which may include a cesarean section. A healthy baby also relies on a healthy placenta. The placenta is an organ that forms during pregnancy and is responsible for delivering oxygen and nutrients to your baby while removing waste. If the placenta is functioning properly, it ensures that your baby gets everything they need to grow and thrive. However, problems with the placenta, such as placental abruption, when the placenta detaches from the uterus before birth, can be dangerous. This can lead to heavy bleeding and may cut off the baby's supply of oxygen. If you experience sharp abdominal pain, heavy bleeding, or any other sudden symptoms, it is important to seek medical attention immediately. Placental problems are rare but can be serious if not addressed quickly. Your overall health also plays a role in your baby's development. If you are generally feeling well and have no major pregnancy complications, it's a good sign that your baby is doing well too. Symptoms like sudden swelling, severe headaches, or high blood pressure, however, can sometimes indicate conditions like preeclampsia, which may affect both your health and the baby's. Preeclampsia is a condition that usually occurs after 20 weeks of pregnancy and is characterized by high blood pressure and signs of damage to other organs, often the liver or kidneys. If left untreated, it can lead to serious complications for both you and your baby. It is important to attend all your prenatal appointments and discuss any new or unusual symptoms with your doctor so that potential issues can be addressed early. While every pregnancy comes with some discomforts, certain symptoms should never be ignored. Sharp, constant pain in the abdomen, especially if it doesn't go away or gets worse, could be a sign of preterm labor or another serious condition. Similarly, if you experience heavy vaginal bleeding, it is important to seek medical attention right away. Vaginal bleeding during pregnancy can have many causes, ranging from minor issues like cervical irritation to more serious conditions like placenta previa or placental abruption. Your doctor will be able to evaluate the cause of the bleeding and provide the necessary treatment. One of the most important things you can do during pregnancy is to trust your instincts. If something feels off, even if you can't pinpoint exactly what it is, it's always a good idea to check in with your doctor. Sometimes what may seem like a small change can actually be an early sign of a bigger issue. It's always better to err on the side of caution and get the reassurance you need. Staying healthy during pregnancy is one of the best ways to support your baby's health. Eating a nutritious diet, staying active if your doctor approves, and following all of your healthcare provider's advice can help ensure that your baby is growing strong and healthy. Regular prenatal care, along with paying attention to your baby's movements and any changes in your own health, will help you stay aware of how your baby is doing in the womb. As we wrap up, remember that every pregnancy is different. What feels normal for one woman may not be the same for another. The most important thing is to listen to your body and pay attention to your baby's movements and growth. By staying informed and regularly visiting your healthcare provider, you can take steps to support your baby's health. If you ever feel unsure, trust your instincts and reach out to your doctor. They are there to help you every step of the way, making sure you and your baby stay healthy throughout your pregnancy. Thank you for watching today's video. We hope this information was helpful. Please leave any questions or comments below, and don't forget to like and subscribe for more pregnancy-related content.